Hi everyone, we'll be presenting to you today about vitiligo. My name is Rupa,
My name is Asia.
My name is Dominique.
My name is Jesmel.
and we'll be covering today the symptoms, diagnosis, pathogenesis, and treatment for vitiligo. So patients who might be coming in will be experiencing different types of symptoms, but they all revolve around the loss of their natural skin color. They can lose pigment anywhere on their bodies, including their skin, their hair, such as their scalp, eyebrows, eyelashes, their mouth, and even their eyes. It's common to have vitiligo on the hands as well. Patients will often say that they might notice its progression and that over the time they start to see the vitiligo and that deep pigmentation cover a larger area. While they lose color on their skin often, this can be such as turning light or even turning white completely. Most people won't experience any other signs or symptoms, and they say that they feel otherwise healthy. There are different subtypes as well, and that they can have a few spots or patches appear that are limited to a few areas of the body, and most people might have scattered patches throughout the body. In a rare case, a universal subtype, most pigment is gone. Some cases, patients might complain that the area affected by vitiligo feels a little itchy or a little painful, but that's not too common. Common, although, with vitiligo is that patients may be experiencing low self-esteem and depression. For the physician to keep in mind as they treat this patient.
So, dermatologists typically diagnose vitiligo following a simple physical examination. However, if more information is required, perhaps regarding the particular way in which your skin cells are being affected by the condition, skin biopsies or blood tests may also be performed. So, first, information regarding past and current health can help the physician confirm a vitiligo diagnosis. The medical history gathered should include the onset of white or lighter patches of skin, as well as whether or not additional regions of the body are affected. A history of autoimmune disease should also be inquired. The physical examination of a potential vitiligo case should be a head-to-toe examination during which areas of depigmentation are noted, as well as whether or not these areas appear on one or both sides of the patient's body, symmetrically, randomly, or only in regions more or less exposed to sunlight. Patients with fair skin may be harder to diagnose, and so in these cases, handheld tools called Woods lamps are used to shine UV light onto the skin in order to distinguish depigmented skin from unaffected skin. Skin biopsies can definitively tell the difference between missing melanocytes or melanocytes that are malfunctioning, and so only if melanocytes are missing warrants a vitiligo diagnosis. Rarely, a dermatologist may order a blood test to gain more information regarding any other autoimmune responses related to vitiligo, such as autoimmune thyroid disease or pernicious anemia.
So what is known thus far about vitiligo is that it's a rare skin disease that causes loss of skin color in patches resulting from the loss of melanin-producing cells called melanocytes. Currently, the exact cause of vitiligo remains unknown, but it is strongly believed to be correlated with genetic and non-genetic factors, such as one's family history, so like hereditary, exposure to oxidative stress and physical trauma, and autoimmunity, which I will all explain. In oxidative stress, this could be due to exposure to UV rays, pollutants, or other environmental factors. As far as physical trauma, this may be due to sunburns or exposure to industrial chemicals and just injury in general. Scientists believe that autoimmunity does play a huge role in the development of vitiligo. So this occurs when our own immune system attacks the cells in our body, in this case, our own melanocytes that I mentioned earlier. This happens when our own antibodies, which basically serves as tags, bind to our own cells and signal to our immune cells to attack us. Because of this loss of melanocytes, there's a loss of melanin, or I should say color. For these reasons, other autoimmune disorders have been linked to vitiligo, such as Graves' disease, Hashimoto's thyroiditis, Addison's disease, diabetes, alopecia, IBD, and for inflammatory bowel disease and other autoimmune disorders.
Moving forward with the treatment, the choice of the treatment really depends on how much skin is involved, the age of the patient, where the skin is involved, and how the disease is progressing and how much it's affecting the lifestyle of the patient. So there are medications, light-based therapies, and even surgery. The results will vary and they're quite unpredictable. The doctor might first start by suggesting changing the appearance of the skin by applying a self-tanning lotion or some type of makeup. So let's move and talk about the medications. There are some that can try to control inflammation. So maybe trying to apply a corticosteroid cream on the affected area. There are also medications that affect the immune system. Those are more like oral medications that try to inhibit different inflammation progresses. Moving on to the therapies, like what was mentioned earlier, there is ultraviolet B light that can be shown onto the skin that can try to slow or stop the progression of active vitiligo. Removing the remaining color, this is depigmentation. So this therapy might be an option if the vitiligo is widespread and treatments really haven't worked so far. There's also surgery. You can do skin grafts. So this is taking small sections of healthy pigmented skin and putting it on the areas where you are losing the skin color. Moving forward, there are drugs that can try to help stimulate the producing color cells. Those are the melanocytes. And those are more of the future treatments that haven't had too much research, but they're hoping that they can try to stimulate those cells to bring color back into the patient's life. So this has been our presentation on vitiligo, and we hope you enjoyed it.